Florence is 9 years old, and hearing reports about COVID-19 spreading through the community concerns her.
I'm really anxious and will I get the virus, will I not get the virus again? Will my family get the virus, will my family be all right?
She is one of many Australian children who felt nervous during lockdown.
Mummy went into a little bit of lockdown, not much. I started to get worried, would my parents lose their jobs?
Kirrilie Smout is a child psychologist based in Adelaide who works with patients across Australia.
Child mental health services are experiencing extreme levels of demand across the country.
Children need routine and structure as much as they need free time and play.
Experts have realised multiple lockdowns can damage a child's mental well-being.
Do see that children who went through second lockdowns have had a greater decrease in mental health than those that haven't.
Since the pandemic began, there has been a dramatic rise in mental health issues in Australia's youth. The Women's and Children's Hospital in Adelaide recorded a 35% spike in mental health presentations by under-17s over the past year. There has also been a 21% jump in presentations to child and adolescent mental health services. SA Health says the stats are similar across the country. Acknowledging the rapid rise in young people presenting at hospitals, the state government has staffed more treatment rooms at the Women's and Children's Hospital in Adelaide that had been set aside as overflow areas to cope with the pandemic. Private practices like Developing Minds are reporting wait times of between 3 and 12 months, and 1 in 3 calls to Kids Helpline is going unanswered. There are big challenges for parents too. Maira has a 3-year-old son, Noah.
What things did we do to keep safe?
We wash our hands.
The mother of 2 gave birth to her daughter Helena during lockdown.
Only my partner, Banjo, was allowed at the hospital. Noah couldn't come and see his little sister until we got home.
Their family members live in Israel and because of the pandemic have never met baby Helena.
It has been challenging not being able to see them on such a big event of our life.
When outside support isn't available, therapists say parents can play a crucial role in the well-being of their children.
Empathy, affirmation to children, supporting them when they're upset, showing interest in them, spending time with them, physical affection, all of that warm, connected parenting makes a massive difference.
Parents were really kind because they were if I was worried if I was going to get the virus, they were don't worry, you're not going to get the virus, which really kind of calmed me down.
The other advice, limit children's exposure to information about the pandemic.
Small children particularly don't need to be surrounded by that information, and even older children need to have limits to how much time they're thinking about and talking about the challenges in our world.
Joel Philp, Sky News, Adelaide.